And please review PrEP pharmacology testing strategy number 3. That is what we're working on, the series. This one has a bunch of stuff in it. You really want to watch. As we progresses, I make it harder. I show you more tricks. This one, the questions are critical thinking, way of teaching you test-taking strategy and answering pharmacology questions. Same thing, I read from the back. Which prescription should the nurse anticipate? That means I need to know that this is what is going to happen. I'm going to give the patient something. I anticipate, I'm already prepared to give the patient something. That means, what do you think the doctor is going to prescribe? Or what do you think the next step will be? A nurse is caring for an 8-year-old male with what? Dyslipidemia. I've underlined the buzzwords. I've shown you the key facts. I read it from the back. And what the question is anticipate asks the case 8 years old with what? Dyslipidemia. Buzzwords, 8 years old, dyslipidemia. Putting it together, 8 years old, dyslipidemia. What do I anticipate? Then you break this down. Dyslipidemia means all the lipid function, okay? This is dyslipidemia. So your LDL, HDL, okay, your cholesterol, your triglyceride, all of them together. So this patient, 8 years old, is a kid, young, has this medical problem. What do you think the doctor is going to give it? All these questions, all these answers can be used to treat this. That is a concept. That was the basis of this series. That figure out every medication. No, you don't need to know all medication for the NCLEX. But when they ask you a question, there's a reason why. Why would I put 8 years old in that question? That means I want you to know one thing. So after today, you should master this concept. 8 years old, most of the medication for dyslipidemia or cholesterol, whatever you want to use, if you're less than 10 years old, you cannot use it. There's only one. There's only one. There's only one medication that you can use when you have dyslipidemia that is recommended to be used. And you can start them when they're 8, 9 years old. But most medication for dyslipidemia, for cholesterol, triglyceride, and all those things, if you're less than 10, we can't give it to you. Niacin, no, you can't use it. Pravastatin, you cannot use it. Fibrate, you cannot use it. The only one you can use is Pravastatin. This is the only one approved to be used in kids. So if they give you a pediatric patient who has cholesterol problem and you need to give them medication, remember that name. The P start with pediatric. Pravastatin, the P means it's for pediatric patient. Don't forget, P for pediatric, Pravastatin. So number 4 is the only one that you can use for these kids. Okay, concept 101. I hope it's informative. Number 2. This is the same. It's a long question, but there's only one key thing you need to know. That's all. What other teaching the nurse should include in the teaching? What other teaching should you include in the teaching? A nurse is providing discharge teaching to a client prescribe what? Epotin discharge teaching as home regimen. What additional? This other means additional teaching should be included. Rewrite your thing. If you're going on with Epotin, what other things should I teach you so that you can let the medication work? I'm talking based on the answer choice, it's not talking about side effect. It's something mechanism, pathophysiology. You know the side effect is this is going to increase your hemoglobin. And so you get polycythemia vera, you get headache, you get hypertension, you get stroke. But the number one side effect is headache, or I would say hypertension. If I see hypertension before headache, that means you are in trouble. Your blood volume has increased too much, so it's a problem. So this is the other side. This is another content. But for this question, what is he asking you? It's asking you, what other teaching can you provide for this patient when it's going on? Protein, what is he going to do? He's going to increase your hemoglobin. How is he going to do that? You need iron. He cannot work without iron. Iron is part of your hemoglobin synthesis. The hemoglobin is divided into, that's why the in portion is an ion. Okay, so you need iron to manufacture hemoglobin. Therefore, this is just one concept. Anybody in protein, you can't take protein and then expect it to work without there is no substitute or substrate for it to work on. Folic acid is no iron. Vitamin C is no iron. A is no iron. Take iron supplement with your regimen. That will be perfect. You see the concept. I know what the medication is going to do. It's going to increase your hemoglobin. What do I need to make hemoglobin? Iron. Therefore, you should take iron supplement. Do I make it easy? No. It's just the concept that I know you need to know to answer the question. So master them when you study. Master them. So when you see the question, become like it comes. Easy for you. The same thing. What is the concept for this? What should the nurse anticipate? A nurse is caring for a client with what? HIV, who is exposed to what? Measles. Concept. HIV exposed to what? Measles. What do you anticipate? Patient HIV is immunocompromised. You want to give them a live vaccine? Negative. Immunocompromised, right? He can succumb to the disease process so bad. Patients who are immunocompromised, when they get infection, we try to help their immune system to help with that, to fight the infection. Of course, we're not going to give them no vaccine, right? Because he's already infected. He's already infected with that, but we don't want the virus, whatever is causing the problem, let them succumb to that, right? We're not going to give them a measles vaccine because it's a live vaccine. How are you going to help these patients to succumb, to survive the problem? Help their immune system by giving them immunoglobulin. Give them immunoglobulin. This is like their form of like antibodies that will fight against the whatever is causing the problem. When we give you immunoglobulins, they're going to act. It's not your body making the antibodies as they react with the pathogens. When your body make the antibodies, when they react with the pathogen, it's called active immunization. Okay, passive immunization is when we give you the antibodies. Okay, it's form of passive immunization. So for this one, if we give you immunoglobulin, we're generating what? Passive immunization. So it's not it's not an active, but it's a passive. I'm giving you immunoglobulin. I'm giving you what you need to fight the infection, but your body is not fighting the infection directly to generate antibodies. When you generate your own antibodies, it's an active form of immunization. But when we give you the antibodies, it's a passive. So this one is a wrong answer. So the best answer is immunoglobulin. You give them immunoglobulin, that will can fight the infection, but they know they cannot generate it because their immune system is down. You should not let them go just like that. This patient, they are bad. They can get sick. So give them immunoglobulin. Okay. Excellent. Now, number 4, bonus 1. The same concept. What should the nurse anticipate? The nurse is reviewing phone call from the infectious disease clinic. The client with HIV found out that the 3-year-old niece is diagnosed with chickenpox. So this HIV patient found out that the 3-year-old niece is infected with what chickenpox. Probably is being exposed to that. So he's worried that he's exposed. What do you think? The same concept as number 3. It may be already being exposed, but you know that chickenpox is a what? Live vaccine. To give you vaccine for this is a live vaccine. You can't get any vaccination. You can do that. He does not have symptoms, but he's worried that he may be exposed, but there's no evidence of that. But we can give him live vaccine. Therefore, you know, shingles and varicella cannot be given to them. But the patient is immunocompromised. You have to save them. You can say they don't have infection, and therefore you don't need anything, no therapy. It's not a good idea. So for this patient, as you can see, it's straightforward. You have to give them something. And that is what I talked about the previous one. Give them immunoglobulin so that they can generate what? Passive immunization to help with the disease process. Otherwise, he's going to get sick. You don't want an HIV patient who think he may be exposed, but he does not have symptoms. You need to help them to fight the infection because they cannot generate their own ability. Their T cells has been like squashed by the virus. 4 questions, test taking strategy, but 3 and 4 is based on the same concept. This is the way you should approach pharmacology question. Break the question down, find what the examiner is asking you, use the content that you think is necessary to do that, and you'll be good. Take care of yourself. Have a good day.